Okay, so we're recording now, and to kick off, I'd like to share with you a video from our CE, Sandy Pitcher, talking a little bit about our department. I don't know if the sound's not sharing. Great. So hopefully a couple of you might have had issues with the sound, but hopefully most of you could hear that or at least follow along the captions there. So that was Sandy Pitcher, who's our Chief Executive, talking a little bit about DHS. For those of you who aren't familiar with our department, we are a South Australian state government department, so not to be confused with the Federal Department of Human Services, which is Centrelink. And as Sandy mentioned, our purpose is to make a difference so South Australians thrive. Our department brings together a lot of different services. So sometimes we're called a federated department because we do bring together such a wide variety of services across the community. But all the services that we deliver have the aim of supporting vulnerable South Australians. This is a little bit of what we do. As I said, we have quite a really wide variety. I'll talk mainly today about the areas where we do employ allied health professionals. But I guess for your broader context and understanding, we do have service and policy responsibility in community services. We deliver concessions, so all of the cost of living concessions that are provided sit with our department. We deliver disability services, so we have a lot of workers who work with people with disability in the community, supporting them to live in independent living units. We provide early intervention for families. We also deliver grants. We work around policy on problem gambling. We have screening within our department, so that's all of the working with children's checks and aged care checks and things like that sit within our department. And we also have responsibility for women with the Office for Women sitting with us. And they really focus around women's participation and equality in society. Youth and youth justice as well are key areas. So we really do have quite a wide variety, and I think that's something that makes our department a little bit unique, that there are many, many opportunities within DHS to gain work experience, particularly, as a new graduate and being early in your career. It's not just coming in here and working within one particular area. You really have that opportunity to be exposed to many, many different types of work and clients that you might work with as well. And then we also do have the corporate support side. This is obviously less relevant for this group, but just so you're aware, we do have corporate support opportunities across the department as well, to ensure that the people who are out there doing the service delivery are well supported and enabled to do their work. I wanted to talk a little bit more specifically about what the opportunities for allied health are within DHS. So recognising that quite a lot on the call today are studying social work. As I mentioned, that is certainly a key area where we do employ graduates, but I know there's a couple of people studying psychology as well. So I'll just go through and talk a little bit about each of these areas because they are all sort of quite distinct and do offer different services to the community and also different opportunities for graduates. So Safer Family Services, and Grace, as I mentioned, is on the call and she'll talk a bit more specifically about the Safer Family Services area. But SFS provides early intervention and intensive family support and assistance to children of families at risk of harm, neglect and family violence by deliberately and strongly intervening. So essentially, Safer Family Services are working with at-risk children and families to help support them proactively to stay together and not enter the child protection system. So graduates are supported by supervisors, senior practitioners and colleagues, and have the opportunity to work with a wide range of cohorts, including pregnant mothers, infants, children and adolescents as well. We also have Community Youth Justice. So DHS runs the Kalana Tapa Youth Justice Centre in the north of Adelaide at Cavan. And the Community Youth Justice area supports, provides services and interventions to help children and young people reduce offending behaviour and build their capacity to live positive lives. And Akash, who's on the call, who's a current graduate, has done a rotation, not within Community Youth Justice, but within Exceptional Needs, which I'll get to in a moment. And so he could speak to that. Youth justice. Exceptional needs that Akash will talk about is a multidisciplinary system team within the Department of Human Services, and that team works with systems and services to help support people and families who have multiple complex needs and risk factors. So, and also with people who are facing barriers to accessing appropriate support. So one example, for instance, is the non-resident disability support area. And so they support people who aren't residents of Australia but have complex disability needs. So they're not able to access the NDIS. So the ENU team provides support to connect them with services that they require. And graduates in this area work predominantly with the ENU response team, which is where referrals are coming in and you're working with those clients. But they also have the opportunity to learn more about other programs that operate within ENU as well. We also have the Office for Ageing Well, which has the Adult Safeguarding Unit, which is a dedicated statewide service that responds to concerns about adults who may be vulnerable and experiencing abuse or mistreatment. So in that area, they might receive a report and then they'll work to gather more information about the situation or perhaps undertake a formal investigation and then work with the person and other services and individuals to develop a safeguarding plan and put in place supports in line with that person's wishes and circumstances. So in that area, the unit provides a short-term coordinating role to ensure that people are connected to services and also that the factors that might be contributing to the abuse the person is experiencing are mitigated. And then the last area where we have opportunities is disability services. So we have an allied health team within disability services. That area is mainly employing physios, OTs, speech pathologists, and to a lesser extent psychologists as well. And they're undertaking things such as therapeutic assessments, functional capacity assessments, mobility and exercise programs, mealtime management plans, and dysphagia and swallowing assessment. So they're delivering services under the NDIS, both to people who may be clients of DHS Disability Services, but also other private clients as well. And then lucky last, we have the Specialist Behaviour Support Service within Disability Services. So they provide behaviour support assessment and develop positive behaviour support plans and intervention plans to support people with disabilities who may be engaging in behaviours of concern. And the main purpose of that is to improve that person's quality of life and try to reduce those behaviours of concern and eliminate the use of restrictive practices. So in that area, that tends to be, in terms of the qualifications, social work qualifications, as well as developmental education qualifications as well. So that's a really quick run through of the key areas within DHS where we do employ allied health professionals and where we do have people within the graduate program who are working within those areas. I understand that I've run through that quite quickly, so I'll just pause for a moment if anyone has any questions. No? Okay, well, certainly if you've got any questions at the end, I'm more than happy to answer it. Just a little bit about our workforce. I just wanted to highlight here, we've got over 3,000 staff who work at DHS, all within the state of South Australia, mostly within the CBD and metro area of Adelaide, but we do also employ people in regional areas of the state as well. Particularly within safer family services and disability services. And one thing that Sandy mentioned in the video that you saw before was talking about diversity within our department. So I would say we are very much a values-based organisation, and diversity and inclusion are certainly values that are very core to our department and to the work that we do, because we do deliver services across the state to people who are vulnerable and maybe also from diverse backgrounds. It's really a core part of who we are as a department. So this is just showing in terms of our own workforce. We do very much celebrate the diversity across our workforce, whether Aboriginal staff, people living with disability, people from non-English speaking backgrounds, and LGBTQIA+ people as well. We do have employee-led networks within the department. So for people from diverse backgrounds who join our department, there are the employee-led networks. We have the disability ELN, the LGBTQIA+ ELN, culturally linguistically diverse ELN, and then also the Nunga network, which is for our Aboriginal staff as well. So those ELNs provide employee-led safe spaces for people to get together and connect with other people across the department and share their experiences as well. Lulu, I can see that you've asked if there are any opportunities for graduates from psychology masters. Yes, there absolutely are. Primarily, we employ registered psychologists, so people who have graduated from psychology, whether that's clinical or forensic primarily, in our youth justice area. So that's working with young people who are in the youth justice system, whether under a detention order or also in the community as well. So that's the primary opportunity there. Okay, so I'll talk briefly just about our graduate program, give you a little bit of information about that. The picture that we've got there is actually a group of our graduates from, they started in September 2023. So most of them are about to finish their 2-year program. So our graduate program is a 2-year program. As I mentioned earlier, we have start dates in September and also February. So I'll talk a little bit later specifically about the application process, but our applications for this year are opening in mid-May, and we'll be recruiting at that time, both for people who will be starting in September 2025 and also February 2026. For allied health professionals, you start at an AHP 1 classification, and this with a starting salary of around $72,000. That doesn't include superannuation. We also provide a 12-month structured professional development program. So basically what happens is in your first 12 months after joining the department, we run monthly professional development sessions, so monthly sort of training workshops. And they really vary in topic, and the aim is to really help you get up to speed quickly in your role and in some of the information that you might need to know. So things like introduction to government, understanding how government works. We do a tour of Parliament House. We also deliver training in trauma-informed care, and also like working with diverse populations, and particularly working with Aboriginal people as well, because they are a core group that we do work with, particularly in safer family services and youth justice. We also talk about things like working with data in a professional setting and how you might use data to influence your work and decision making, and also professional writing and briefing and writing case notes and all of those types of things as well. So it's a really great way to get up to speed quite quickly with some of those core skills that you might need, in addition to all the learning that you will obviously do on the job in your team, actually doing the work and getting that direct feedback and support from your supervisor. We also have opportunities for job shadowing to broaden your experience. So that's where you might go and do a couple of days or a week's worth of shadowing in another team in the department to get an understanding of the work that they do. Some graduates within the graduate program also do a rotation. So Akash, who we're going to throw to quite soon, he will talk about some of his experiences, and he's doing his second rotation now. So, but it does vary. Some of our graduates in the social work stream do stay within one business area, but might rotate within teams. Others will rotate between different areas of the department. And then we also have networking opportunities within the department and across the public sector, which is a really valuable way to kind of get out and meet people from other parts of the public sector and also DHS as well. Other work perks in terms of what we offer, we definitely have flexible working arrangements. So these are usually worked out, you know, if you were successful with your manager individually, but certainly access to things like flexi time, compressed working weeks, other things like that to enable you to fit work and life together. We offer salary sacrifice. So as a government organisation, we have access to salary sacrifice benefits where you can use some of your pre-tax earnings to pay for things like a car and things like that. I've already talked a little bit about the professional development and learning, but certainly we have a strong focus on that side of things. And so there are many opportunities, you know, for learning and development in your role. In terms of wellbeing, you know, we have access to flu vaccination programs, EAP, and many other wellbeing initiatives, as well as access to My Fitness Passport, which is sort of discounted gym membership and things like that, so that you can sort of take care of your physical as well as your mental wellbeing while you're at work. And then in terms of superannuation as well, you know, for some of you, retirement might seem a long way off, but we know it's really important to start saving early. So we have Super SA, which is a dedicated fund for SA public sector employees. You're not obliged to join it, but it does offer you some benefits in terms of being able to salary sacrifice additional money into your super early. So they're just some of the other benefits of working within the state public sector and particularly at DHS. Okay, I think I've done enough talking for now, so I'm going to pass over to Akash, if I can, to share with us a little bit about his experience at DHS.
All right. Thanks, Anna.
Hi, Akash.
Hello, everyone. Nice to see so many people here today. My name is Akash, and I am a graduate social worker. I graduated from Flinders University in July, and I started with the graduate program in September. So I have completed a little over 7 months now. So my first 6 months were in the exceptional needs unit, which we just ran through previously in the presentation. And now I am with the Office for Aging Well in the Adult Safeguarding Unit. So yeah, I think being in the program is really helpful as a graduate social worker. I felt that something that is very important as a young professional is to have opportunities for professional development, and that is obviously linked to our practice standards as a social worker and the code of ethics, so that you always need to be updated. And that is the first thing that kind of attracted me, that okay, let me try and apply for this role. And apart from that, being in the public sector also helps because you can see the social problems that the state is facing and what are the priorities of of the state in terms of what the concerns that we are going through right now. Um, so those were the two reasons why I would say that this is a really good program to be in. Apart from, the opportunity to also have a lot of mentorship or clinical supervision from your seniors and the people that you work with in the team are coming with a lot of experience. So as a young professional, you also get that support. And especially because you are in the graduate program, you are provided with a lot of time to pick up the skills that you would otherwise would not have the time to. And as a social worker, as you know, that you are always in tricky situations. So we're going to ask those questions too. So you get a chance to really have the time to put your learning, whatever you have learned, um, into practice, but in a more slow paced, something that feels comfortable but also challenging at the same time. A little bit about my rotation. So, like I said, I was in the exceptional needs unit, which is usually the point of you know uh, contact for people in the state when everything else has failed. So you are really meeting people who have nowhere else to go. So you're going to be meeting people who are quite vulnerable, which brings its own challenges. But then the rewarding part is when you actually help them, or you're able to see the progress that they make. It's very, very rewarding, and especially in the sector that I worked in, which was in the disability sector for non-residents. So they don't have access to NDIS or Medicare. So just helping them with, assessing that first in terms of what works for them and working with a really culturally informed lens. So it's actually helping you as a social worker, because I can speak from my lens as a social worker, to develop those different skills that we always talk about in our practice standards and code of ethics. Um, so now, after 6 months, I have moved over to another department, which is the Office for Aging Well, and in that, I'm working in the Adult Safeguarding Unit, which is for preventing any kind of abuse towards adults. Earlier, this was meant only for older adults, about 65, but now that has been expanded to all adults. So anybody who is a vulnerable adult has the right to live his life, away from abuse. So my life over here is quite different from exceptional needs because now I am going, I visit the court as well, sometimes representing the interests of the vulnerable adults that I work with, working with other state government organizations like police, hospital, education, things like that. So it's also about coming together as a team. Apart from social workers, I work with a lot of other professionals. So you're really developing the skills and learning from all the other people that who have to offer a lot to our community. And apart from that, I would say the program is also offering a lot of training programs, opportunities to do some networking as well. So you are not only working with other social workers. We have this with this habit of sticking together as social workers. But in this program, you will be meeting people from all different backgrounds. So that will help you in a way to expand your thinking and what all others are doing to help the state thrive in the way that it needs to be. Um, One thing I would definitely mention is that whoever is interested in applying for this program is to go over the website first and see what speaks to you, because there are so many different areas, and that will certainly help you when you are putting down your application or writing down what interests you, and that will certainly come forth in the application process. So for me, it was about disability, about things like safeguarding. So these were the basic themes that I worked with, and that really helped me to put forth my ideas and what I can offer in this graduate program. So that's what I would say for those who are interested. And apart from that, all the best. And I hope to see you in DHS. And if you see me, then you can wave and we can have a chat. Thank you.
Thank you so much, Akash. That was really great to hear about your experiences. One of the questions that maybe you might be able to provide your perspective on that's just come through in the chat while you were talking was just if you have any tips and advice for students about being a future social worker.
Oh, that's a very good question.
A broad question.
It's a broad question, but it's something that I am always learning as well, because even though I have graduated, you're always learning. So I think keeping yourself updated in terms of what is happening around you and always asking why, like if that comes to you, why is this like this? You know, things can many times be better than what they are. And sometimes there is a reason behind why. So if you ask those questions, um, you will be on the right track, is what I feel, and that's what I am trying to do even now. Even though I have finished my study, hasn't ended. You still get to learn a lot from your seniors and from the area that you're working in, and that somehow connects the dots. You know, from exceptional needs units now to the adult safeguarding unit. Those people that I was working with disabilities, they were mostly children and young people. But once they grow older, they can be in the realm of adult safeguarding someday. So how does that connect? Those two dots are connecting with each other. So whatever you do, there is a reason behind that. So I would say in your placements, or if you're just starting out, just keep doing that, and I think you will be a great social worker. Yeah.
Thank you. That's great advice, and I think Grace could probably agree that there's certainly a constant learning element, you know, in any of the allied health professions, and particularly in social work, that you never stop learning. Thank you, Akash. If you're happy to hang on the line, and we'll have some time for questions at the end, and some of those might have some specific questions for you, if that's okay. I'm just going to go back to sharing my PowerPoint again. While we were talking before, Jeff's just asked if we're allowed to choose our rotation areas, or do we have to go through all of them in the 2 years? So we do certainly try to take into account graduate preferences in terms of the rotation areas, but certainly a big part of it is very much the need within the department. So it is a bit of both, where we will try and take into account what your preference is, but ultimately it may come down to where there is a need in the department for that position. In saying that, usually what happens with the rotations, if you do a rotation, is that you'll be in one area for the first 6 months of your first year, and then as Akash has done, you rotate to another area for the second 6 months of your first year, and then most people will rotate back to the area that they started in for their second 12 months. So usually the rotation will incorporate working in 2 different areas within the department. That way you then get to consolidate some of your skills and be able to sort of apply them back to where you first started. Okay, so I'm going to hand over now to Grace Bohomi, who is currently the placement program coordinator within DHS for Safer Family Services, but has previously been a practitioner within SFS, to talk about her experiences. So Grace, over to you.
Thank you very much, Anna. It's so lovely to see you all. Welcome. Just to add on what Akash talked about, I think passion for your work is quite important as a social worker, because once you have the passion, then you're able to go beyond, your call of duty, and you'll not be deterred at all. So thank you, Akash, for just introducing the social work into this session. So as you heard from Anna, my name is Grace Wahome, and I'm the placement program coordinator for Safer Family Services. I've worked with Safer Family Services for about 3 years now, and my educational background is social work, and also I have a degree in education. Prior to my role, I worked as a senior practitioner in the Safer Family Services team located at Flinders Park. But prior to that, I also had some extensive experience in DCP, that is Department for Child Protection, where I worked in various teams, including guardianship, long-term guardianship, kinship care, and I also worked in Port Augusta. For those who might be interested, social workers, Port Augusta and the other regional areas are really quite a good area for you to begin your or maybe during your social work career, because there's all pros and cons, and you continue learning, as Akash has mentioned. So the passion I have for the work that we do in Safer Family Services led me to my current role. And I take pride in the outcomes we get for children and families that we support. Ultimately, keeping children safe and well at home, connected to their family, community, and culture. I think we all know as social workers that research has it that children thrive when they are within their community, within their family, within their culture, within their when they're learning their language, within kinship, etc., and within their country. However, in Safer Family Services, safety is our core business. It's like our bread and butter, safety of the children. So we are striving to keep these children in their families, but working very hard to ensure their safety. So I'm grateful that I can now pass on my practice wisdom, which I've garnered all through the years, when speaking with upcoming social workers like you people. So we're going to talk about our overview of how Safer Family Services came about, because I think it's important for us to know. I always encourage students that when you go to work in the morning, think about why you have come to work. I think Akash mentioned that. Why am I doing this? Why am I going for family contact? Why am I going for a home visit? So what is the reason in the bigger scheme of things that you're doing, the things that you're doing, so that we just don't get robotic and do things just because we are doing them. When we understand the why behind it, then it makes a lot of meaning, and it gives us a lot of motivation in what we are doing. So today we'll quickly look at, in the next few minutes, we'll look at the role of overview of how Safer Family Services came about, the role, that is what we do, and a day in the life of a social worker, which was a good question that was asked by someone here. Yeah, we'll look at those three today. So with regard to the overview, child and family support system, that's really the origin of Safer Family Services. So in 2019, that is 2019, the government approved a strategy for a new child and family support system. And this is because the number of children who are coming into care due to child abuse and neglect concerns was rapidly growing. So this strategy was designed to address the amount of child abuse and neglect concerns that are rapidly growing and the children needing to enter care. And in order to create meaningful and sustainable change, it was agreed that the new system must be informed and co-designed by people who needed the services. So we call them people with lived experience versus the people who are delivering the services. So there was a whole consultation process. Remember, that was 2019, as I mentioned, a whole consultation process which involved about 1,000 people. So it was extremely thorough. People across the system being interviewed and asked about what the new system would look like. Like, what is the best way to support these vulnerable communities and families that you work with? So that was the origin of child and family support system, in which Safer Family Services works under. So let's just go to the next slide, which talks about the division. Child and Family Support Division, which is a division in DHS. So, which was formed about from the child and family support system that we just talked about. So one of the directorates is Safer Family Services. As you can see there, we've got 3 directorates there. And Safer Family Services is the government provider of intensive family services within the child and family support system. And like I've said, it is a division within the Department of Human Services, which delivers a range of services, policies, and programs. And what do they do ultimately? To help families keep their children safe and well at home, connected to family, community, and culture. So we do provide early intervention and intensive family support and assistance to South Australian children and their families under the CFS, so Child and Family Support for families with children from pre-birth to 18 years of age. And those are children who are presenting with high level of child protection risks and complexities. We are committed to providing services that are inclusive of the child's voice, those who have heard about the child's voice, and we do not position children as passive recipients of services. So that means that whatever we do, you know, like when we are going for home visits or whatever, we listen to the voices of the children, because you get a lot when you talk with a child. You know, you go for a home visit and you're asking a child, so how was your day today? How was school? You know, what did you have for dinner last night? You know, things that children will always come out and say. And out of such conversations, children have disclosed very important information that has helped us in our direction, in the case direction. So SFS is committed to working restoratively, building on resilience and strengths of Aboriginal people, working with and listening to them and hearing and acknowledging their cultural identity, which is really important, you know, working with the community and listening to them. What's your culture like? And learning a lot about the culture. So also we work with non-governmental agencies, so including which are called ACO, so Aboriginal Community Controlled Organizations, who also help us to provide intensive supports to complex families that are referred to our service. So for example, if we have a case where we have closed, for example, we might refer it to an organization like KWY to continue managing that case, which is culturally appropriate to continue managing it. So we talked about family services. The other directorate, which I won't go into, is pathways, evidence, and partnerships, and also one which was newly created last year, which is called system stewardship. There are also other, for example, there's community capacity building as well, which comprises of community development programs. So there are other programs as well, which you can consider them like in getting involved in the families on a like lower level, if you consider it like a continuum. So on the lower level, you have community development programs, you've got parenting SA, and also programs like families growing together, in those kind of in that kind of continuum, and then going all the way as the cases get intense, then they go to intensive family services. All right, so the second thing we're going to talk about is the role of Safer Family Services, and just the slide which was before that one, the one for who are our priority populations. Thank you, Anna, for that one. The infants at risk, young parents, adolescents with complex trauma, and Aboriginal families are our priority populations. So with infants at risk, just to give you a little bit of some statistics, every year we have over about 1,000 families that are reported for concerns about unborn children. And out of these families, a third are likely to have one or more children enter care within the 4 years. With young parents, research has shown that a large proportion of children in care have a mother who had their firstborn before 20. So most likely, if a young girl has a child before they were 20 years old, a large proportion of those children enter care. And research has shown us that these mothers are often at increased risk because of their own child protection history, with 7 in 10 having subsequent engagement with the system. So those are our priority populations. Adolescents with complex trauma, more than half of all child protection reports are about children and young people between the ages of 8 and 18, and working with Aboriginal families who are vulnerable. Their children, as we all know, Aboriginal children are significantly overrepresented in the child protection system, in the juvenile system, and they represent approximately a third of all children in out-of-home care. So basically, that is our priority population. I'll quickly talk about our programs. So for example, when I mention infants at risk, we have a program called Safe Start, and the Safe Start is 0 to 2 years. There is a Safe Start office in Salisbury, Whyalla, Nolanga. The reason I'm mentioning this is just for you to have an idea of where the different offices are and what we do, so that as you kind of form where you would like to go with your social work degree, you might think, I might be interested in working with families, vulnerable families with infants 0 to 2, and maybe I live in the south or I live in the north. So there is an office for Safe Start, 0 to 2 years, Salisbury, Whyalla, and Nolanga. And then there is a Strong Start office. So with Strong Start is what you can see on the screen there. And these are services for young parents with infants at risk. So young parents, like we talked about, the young women who have had children who under, when they're below 20. We've got an office located at Elizabeth Grove and Nolanga. So this office works with first-time mothers who are aged under 25, and we provide support to the family until the infant is 2 years old. So if that is something that can interest you. We also have family practitioners that provide services for children up to 6 years old. There is an office located at Flinders Park and Walkley Heights as well. So Walkley Heights has actually has a new team. It's called In and North. Sorry, that's not updated in the slides as yet. This is a very new team. So whilst Safe Start, Strong Start, Family Practitioner, and Child Wellbeing are clearly identified as such, there's a new team in the Inner North, which is actually working with children from 0 to 18 years. So initially, you would get a case for infants at risk. Your cases would be infants at risk, or they would be, with the young mothers, or they would be children up to 6 years, or they would be the next one, which is Child Wellbeing Program, which is for adolescents. But now, the new Inner North team is working with children from 0 to 18 years old. So as well, we keep learning. I'll go back to what Akash said. As we learn, we realize, maybe we can do this differently. So initially, that is how the programs were delivered, but in the Inner North team, they have actually combined them. So the next slide talks about a day in the life of a social worker. So when we go to work in self-family services, we have a daily hurdle. But before I talk about the daily hurdle, I'll just give some statistics as well, because it's very important that we work with statistics. Then we know the money the funds that we are allocating, are they meeting the needs? Are they going into or being channeled to the right places where they're meeting the needs? So across the state, Self-Family Services works with approximately 1,000 families at any one given time where there are high-risk child protection concerns. And as a Self-Family Services practitioner, no 2 days are the same. The work is complex. Families are in crisis, and it is not uncommon for families to go in crisis for several families to go in crisis at the same time. So you've gone to work, for example, and then you have a family that is in crisis. Then while you're working on that one, another one is in crisis. And that's why passion for your work, passion for the children that you're working for to keep them safe is very important in the work that we do. At our daily hurdle, we discuss families that we are worried about, and we also discuss the actions to be put in place. For example, if we've not cited children within 14 days, we will discuss that. If there are cases that, so what I mean by that is that we must cite children within 2 weeks. If there's any escalations to DCP, so for example, if we normally receive our notifications mostly from DCP, health, education, that's where our referrals come from. That's where our referrals come from. So if we are not if the family is not able to make the necessary changes, then the child is really, really at risk. Then we escalate back to DCP. So that's why I'm saying at this daily huddle, we also discuss escalations to DCP. And we also discuss any cases that could open or could attract media attention. So for example, if grandma says, I'm going to do this, I'm going to go to Channel 9, I'm going to go to Channel 7 or whatever media, we have to discuss that at daily huddle, and then we take the necessary steps. There's some
Grace, sorry to interrupt. Just wanting to leave some time for questions at the end. So maybe if you could just wrap up in a minute or so. So we could just have some question time. Thanks.
Yeah, that's all right. I think this was the final thing that I was talking about. We do case management and we've got forms for that. We do home visits, like I've explained, and the forms I've written there, like risk assessment forms, the safety and case plans. Those are all forms that we use to complete the information. HRA that you can see, the high risk alert forms, are the forms that we use for alerting in the daily huddle that I've talked about when we are escalating in case of media attention or adverse events. We use the high risk alert forms. And then we do also work in partnership with the DCP and many other NGOs, like we've talked about. We have case conferences, case reviews, and file audits with government organizations like DCP and schools, etc. We collaborate with all those people and also NGOs, like we have said. Professional development for any social worker is very important, where you go and you discuss your cases with your supervisor, and where you need debriefing, you talk about debriefing, how you're caring for yourself is very important. You need to care for yourself so that you care for the families that you work for. Okay, I think I'll bring that to a close. Thank you so much, Anna.
Great. Thank you so much, Grace. That was really excellent to hear a bit more about Safer Families and particularly the day in a life.
Mm-hmm.
I just wanted to leave a little bit of time to talk specifically about the graduate program, because I know that a lot of you on the call today are graduating this year, and so I imagine that you're already starting to think about, what would life after uni be like, and thinking about getting a job. So to speak specifically about the graduate program within DHS for the 25-26 program, so as I mentioned, that's starting either in September this year or February next year. In terms of eligibility, you just need to have completed, to apply for this round of the program, you just need to have completed your undergraduate or postgraduate degree by December 2025. You need to be a citizen, a permanent resident, or a visa holder with working rights in Australia. So we are happy to receive applications from people who are currently on international student visas and are anticipating that they will transition over onto a postgraduate working visa at the end of their studies. You need to be able to provide appropriate screening checks. So all roles require a police check, and most roles, particularly in this particular stream, will potentially require a working with children check or an NDIS screening. We will advise what the requirements are, because it just depends on which area you're working in. But you just need to already have those checks in place or be able to successfully pass those checks. You also need to have not previously completed a graduate program within or hosted by the South Australian public sector. And someone did ask before about whether there is any age limit on the program, and there is not. And they're really the only eligibility criteria that I've listed there. So some of you might have come straight from school into your degree. Others, we understand, will have had careers before and maybe coming back to uni at a later date, and that's totally fine as well. And yeah, you just need to complete a degree in one of the following areas. So I know, as we've discussed, we've got a lot of social work students on the call today, but we also accept applications from students studying a Master of Psychology, Occupational Therapy, Physio, Speech Path, Positive Behaviour Support, and Disability and Developmental Education as well. In terms of the key dates and the application process, so applications for the 25-26 application program, will open in mid-May for a 3-week period. The program is advertised on I Work for SA, and I've just got the website there. You may all be familiar with that, and it's also advertised on Seek as well. We did have a question from someone who's studying social work that is interested in getting into policy roles, so that we certainly had that before. We will be advertising for the 2 streams. So there'll be one ad for the AHP stream, and that'll be for some of the roles that we've talked about today. And then there'll also be another ad for the ASO stream, which is more the policy and corporate type roles. So if you're interested in a policy role, you're welcome, but you have a social work background, then you're welcome to apply for both. And we have had people do that before, which is fine. I would suggest going on perhaps the I Work for SA website. And when you jump on there in the top right corner, there's an option to set up job alerts. So if you are interested, I suggest you do that so that you don't miss it. And that way you'll get an email when the graduate program is open. If you just set up an alert perhaps for graduate, and then you should get notified when, because other departments do run graduate programs as well, you might get notified when those open too. All departments run their programs individually at this point in time. So other departments will have different times of the year when they recruit. In terms of the application, we'll be asking you to submit a resume. Ideally, try to keep this to about 2 pages, and also a cover letter, which will be asking you to respond to some particular criteria or some particular questions. So when you read that, just make sure that you respond to those items. If I'm giving you any advice about your applications, certainly making sure you read through what the application criteria are and ensuring that you're addressing all of those in your cover letter will certainly go a long way so that your application gets read. If we receive applications where candidates haven't addressed the criteria, then we do tend to pass over those for the ones that actually have addressed the criteria. So that's a really easy way to get your application actually read. We will then shortlist from that point of view, and there will be assessment centres that will be held in July this year. So that will be where you'll come in to our offices for about half a day, and you'll undertake an interview, so an individual interview with a panel. And then also there'll be a group activity as well where we will, you have a problem that you'll solve with some other applicants also. In terms of what we look for in applicants, we look for people who really have a passion for the work that we do. As I mentioned earlier, we're very much a values-driven organisation. So people who show integrity and are really committed to making a difference are some of the things that we look for. In terms of using AI in your application, we understand that a lot of people will use things like ChatGPT, and it's really just becoming a part of the way that we work now. My recommendation there would be, if you wish to use it to give you a framework for your application, but really make sure you go through and you personalise your application. ChatGPT is great for writing a cover letter, but it will also write the same cover letter for 50 other applicants. And when you're reading through lots of applications, it becomes obvious quite quickly the ones that have actually been written by a person and the ones that have been written by AI. So really make sure and go through and make sure that you tailor it and personalize it and make it you. We really like to see and feel like we're reading an application from a person, and that's actually what will make your application stand out. That is everything I wanted to go through. There's just a couple of questions in the chat that I'll address, and then I understand that we're coming up to our time. So if you need to leave, feel free, but I'm happy to stay on for a couple more minutes and answer any other questions. So in terms of positions for each intake, look, it does vary. Overall, in the last couple of years, we've recruited about 18 to 20 graduates per intake. In terms of social workers and allied health, it tends to be about 4 or 5, but it does vary year to year. Young, unfortunately, we don't offer visa sponsorship. You need to already be eligible to work in Australia. Can we apply for it if you haven't completed the degree? So you need to have completed your degree by the end of this year. If you're graduating next year, you'll need to wait for the next program. I can't predict the future in terms of the graduate program, but we are intending to continue to run it. So for those graduating in mid-2026, it'll be around May next year that those applications will open. And no, there should be no need to follow the application via email. You will submit it via the I Work for SA portal, and we will receive your application, and then we'll get in contact with you once we've shortlisted to let you know whether you've been successful at that stage or not. Thank you for your questions. Hopefully I've addressed those that are already in the chat. do we have any other questions, whether you want to put them in the chat or you feel free to raise your hand, whether for myself or Grace or Akash as well. In terms of a driver's license, I think it's preferred, certainly for the social work roles. I think it is required because you do need to be able to travel to clients and between sites. Are you aware, Grace? Is that correct?
Yeah, that's correct.
Yeah.
Yeah.
Roughly how long will be the application process to the successful stage? So applications are due in May. As I said, we'll run assessment centres in July. So people should hear in June whether they've been shortlisted. And then we will look to advise successful candidates in August. Psychology honours graduates would be eligible to apply for the ASO program, where you might be working in more of a policy role. To work in the AHP roles in psychology, you do need to be a registered psychologist, which means completing the master's program, but we certainly have opportunities in the ASO stream for psychology honours graduates. So if you're completing your study in December this year, you can apply while you're still studying, Jatin. But you would commence in February 2026. So you can apply while you're still studying. Yeah, but then you just start at the start of 2026 if you were successful. Belinda, what we found so far, so Belinda's asked, do most people going through the program end up working for DHS once the 2 years are finished? Imagine that jobs may not be guaranteed. That is correct. At the end of the 2 years, there is not necessarily an offer of an ongoing position. What we have found so far is that many graduates are winning high-level roles even before the end of the graduate program, and certainly at the end winning other roles. So look, there's not a guarantee of an ongoing position at the end of the program, but certainly, we do find that we are recruiting graduates within our program who are successful and do win other roles within the department, or some do win other roles in other government departments as well. Yes, Jeff, I have been recording today, and so I'll provide that to Philippa at Flinders, and she will share that with those on the call and others who weren't able to make it. What do we look for in a successful candidate, Jatin? So there's lots of different things. As I said, I think that strong values, drive, and also commitment to the work that we do. From a social work point of view, or allied health in general, we do look a little bit at the theories that you have developed through your uni studies. And also ability to learn, teamwork. We look at a lot of general qualities in our candidates, but certainly from the application process, we're really looking to understand your motivations and drivers for applying for the program and how you fit within our department. Yes, so the session this afternoon is focused on the ASO stream, which is the policy roles, not the service delivery allied health roles. So they are different, although some of the information will be the same. Great. Okay, we've run over a few minutes. Is there one or two final questions before we finish up? Vi.
So I'm really interested in to know more about the selection criteria and how to address them. Like, do you have word limits on that, or we can go as long as we like?
So all the information about the actual application will be provided when the job ad goes live. We've got a whole FAQ document, a how to apply document. We are still finalising what that will look like for this round of the program. We probably won't be asking you to, write long statements in relation to each of the key selection criteria. But if there are any particular word limits, we'll make sure that you're aware of those when you're applying.
Okay, thank you.
Thanks. Okay, I'll just answer these couple of last questions and then we might finish up. And I'm just going to put this on the screen too. So if you'd like to scan this QR code, you can follow our profile on the Flinders Career Hub, and you'll also get alerts for vacancies as they are published. Jeff. So yes, there are 2 stages. Yes, resume, cover letter. We will shortlist candidates from that, and then the assessment centre. That is correct. And yes, the ASO stream does take social work students if you'd like to do, if you're interested in policy work. So I will post on this chat afterwards the link for the afternoon session if you are interested in attending that as well. All right, we might wrap up now, everyone. Really appreciate your time today coming along to learn about DHS and the services that we provide and some of the opportunities that we have for graduates. I'll also mention that on our website and also on the iWork for SA website, we do also publish opportunities for entry-level roles for social workers that aren't specifically part of the graduate program. So certainly recommend that you check that out. And you're welcome to look at other AHP roles that might be available there too. Thank you so much. Hope you all have a great day.
Thank you, Anna.